Welcome to the discussion of the Uworld question ID 2636. In this case, the present symptoms are worsening of cough and episodes of hemoptysis. Something to note that smokers tend to have cough and they know their frequency, their severity, their intensity of their cough. But when they come with a worsening of cough, this is something to concern. It might be a COPD exacerbation, it might be something else, like in this case. There is weight loss and temporal wasting, along with hemoptysis. These are concerning signs. You start thinking about cancer. It's directly like weight loss happens due to cachexia. He doesn't eat well because cancers produce a lot of stuff that are discussed in the pathology. History includes smoking, and smoking is a risk factor for lung cancer. It's obvious. In the labs, the only two abnormal things are hyponatremia and hypoalbuminemia. And the most important thing in this case is hyponatremia. While hypoalbuminemia, it might happen in cancer. He's cachexic, he doesn't eat, he loses weight, there's malnutrition, okay? That's why there is hypoalbuminemia. And in the answers, there is albumin infusion. This is not the correct answer, this is not the major concern. Okay, we have to correct malnutrition due to cachexia, but this is not what he's asking about, the question, or this case is asking about. Okay, we should manage hypoalbuminemia. And the thing to worry about, like in this case, there's hyponatremia, and hyponatremia is caused here by something called syndrome of inappropriate ADH secretion. It might be caused due to hypoalbuminemia in cases of liver cirrhosis, but this is not the case here. So that's why we won't discuss hypoalbuminemia. We will be discussing hyponatremia. What's absent in this case is nausea, vomiting, fever, chills, night sweats. These things are absent. So this fever and chills and night sweats might be a TB. Like TB can cause wasting, night sweats. It can cause fever. It's not present in this case, so you exclude certain types of infections like TB. Nausea, vomiting. There are some infections in the lung may cause GI disturbances, especially the atypical infections like Legionella or Mycoplasma. Anyways, there are no seizures, there are no abnormal neurological examination like the gait, the eye, the orientation. There is no abnormality. Why is he saying this in the case? That's because some causes of hyponatremia include syndrome of inappropriate ADH secretion, and it might be due to central nervous system problems. Okay, so there is no dehydration. How did I know that? The mucous membranes are moist. There is no ascites. Like when we did the abdomen examination, the abdomen is soft, it's not tender. This is exclude ascites. Okay, there is no peripheral edema. Why does that happen? Because there is something called euvolemic hyponatremia. You should know this. You should know that in syndrome of inappropriate ADH secretion, the volume is normal. There is no hypovolemia, there is no dehydration, there is no hypervolemia or volume overload. Okay, volume overload can be seen with congestive heart failure. Like if you hear something like S3 is caused by volume overload, either due to heart failure or any other cause of volume overload. So there is no overload, so it's euvolemic, and there is no dehydration. There is no ascites. Why there is no ascites or edema? This is because there is hyponatremia, but there is euvolemia. There is no lymphadenopathy. Why would I worry about lymphadenopathy? Because of the spread of the infection of the cancer. You see that if the cancer spread, it will go to the lymph nodes, and there is no lymphadenopathy. It's a good thing. Lung auscultations, there is no abnormalities when you auscultate the lung. This means there is no pneumonia, there is no lung infection by any means. So you see lung cancer features. There is hyponatremia. This is going to be small cell lung cancer causing syndrome of inappropriate ADH secretion. How do you manage that? First of all, we treat the cause. If it's caused by CNS disturbance or a cancer, we try to treat accordingly, right? We see if it's like gonna be curable or not. Small cell lung cancer, however, is like have a bad prognosis. You restrict fluid. The means for this is behavioral. So some patients won't do it. You still drink water. It's hard to restrict fluid to 1 liter per day. The target is to increase sodium levels, to restore normal sodium levels. You can give salt tablets, or you might not, according to the severity. But the thing is, hypertonic saline is never given. Hypertonic saline is never given. Neither the lactate ringer or normal saline, because there is euvolemia, there is no dehydration to give saline. You don't give hypertonic saline, except only in one case, in the CNS disturbances, because hyponatremia can cause seizures. If the patient had seizures attack, then you can start using hypertonic saline. Demoxycycline is not typically used due to nephrotoxic. You should just know that it might be used if these other things failed, like out of desperation. There are also other things like tolvaptan and convaptan. They're not mentioned in the case. And that concludes the question. If you have any question, do not hesitate to keep it in the comment section. Thank you.